Nerve supply of auricle. Great auricle nerve. It supplies most part of auricle, especially the lateral aspect and the ear lobule. Auriculotemporal nerve. It supplies the tragus, vagus nerve, but fibers carried by facial nerve. It supplies the area of opening of external auditory meatus. Lesser occipital nerve. It supplies the upper part of auricle on medial aspect. Auricular branches of vagus nerve. Hitchhike, hitchhike the facial nerve to supply the area around the opening of external auditory meatus, root of auricle. Important information is auricular branch of vagus nerve. Hitchhike the facial nerve to supply area around opening of external auditory meatus and root of auricle. Middle ear cavity. It has three parts: epitympanum, mesotympanum, hypotympanum. Epitympanum is the largest part. It contains most of the handle of malleus and incus. It contains chorda tympani now. Mesotympanum is narrowest part. It contains footplate of stapes. Hypotympanum 4 mm. Eustachian tube opens into it. View of middle ear cavity after removal of tympanic membrane. Course of facial nerve. It is accompanied by vestibulocochlear nerve. They both enter the internal auditory meatus. Facial nerve runs on roof of middle ear cavity and then runs on posterior wall of middle ear cavity, running in facial canal. Gives three branches: greater petrosal nerve, nerve to stapedius muscle, cauda tympani nerve. Then they exit the styloid foramen and passes parotid gland to supply muscles of facial expression. Boundaries of middle ear cavity. Lateral wall, tympanic membrane with cauda tympani nerve running on it. Roof, tegmen tympani bone. It is a thin bone. It separates the middle ear cavity from temporal lobe of cerebrum at the floor of middle cranial fossa. It has an arcuate eminence produced by anterior or superior semicircular canal. Medial wall structures, prominence of lateral semicircular canal. Oval window where the stapes footplate attaches. Promontory produced by basal turn of cochlea. Tympanic plexus contributed by tympanic nerve coming from floor of middle ear cavity. Processes cochleariformis. Floor of middle ear cavity, tympanic membrane, branch of glossopharyngeal nerve, bulb of internal jugular vein. Posterior wall structures, facial nerve running in facial canal, giving some branches. Pyramid, tendon of stapedius muscle attaches here. Mastoid antrum auditus. Anterior wall, eustachian tube coming from nasopharynx. Canal for tensor tympani muscle. Internal carotid artery with T1 sympathetic plexus on it. Schematic diagram of middle ear cavity. Otic placode developing in surface ectoderm near the neural tube. Otic placode, then into otic pit, then into otic vesicle, then into inner ear. Firstly, there is this formation of utricular saccule for linear acceleration. Lateral cochlea for hearing. Semicircular canals develop. Angular acceleration. Inner ear, vestibule for linear acceleration. Saccule utricle. Three semicircular canals for angular acceleration. Cochlea for hearing. Sound waves vibrate the tympanic membrane. Vibrate the malleus incus stapes. Vibration on footplate of stapes. Perilymph vibrations in scala vestibuli. Continues as scala tympani. Continues with round window. Middle ear. Inner ear. Outer bony labyrinth has perilymph. Inner membranous labyrinth. Bony labyrinth, membranous labyrinth. Bony labyrinth. Cochlea, vestibule, semicircular canal. Membranous labyrinth, cochlear duct, utricle saccule, semicircular ducts. Cochlear duct, utricle saccule, semicircular ducts. Vibration reach the footplate of stapes. Vibrates the perilymph in scala vestibuli. Vibrations reach the helicotrema. Vibrates the perilymph of scala tympani. Extra energy dissipated through the round window into the middle ear. Vibrations reach the footplate of stapes. Vibrates the perilymph of scala vestibuli. Vibrations reach helicotrema. Vibrates the perilymph of scala tympani. Extra energy dissipated through the round window into middle ear. Cochlea has three cavities and three membranes. Three cavities of cochlea: scala vestibuli, scala media or cochlear duct, scala tympani. Scala vestibuli is filled with perilymph. Scala media or cochlear duct, it is filled with endolymph. Scala tympani, filled with perilymph. Three membranes of cochlea. Basilar membrane is present between scala media and scala tympani. Vestibular or Risner's membrane, it is present at the base of scala vestibuli between scala vestibulae and scala medium.